Okay, good afternoon, everyone. We are going to go ahead and get started. You should be able to see on my screen some slides currently saying Behavioral Health Equity Challenge. Please do interrupt me if there are any issues with the slides or with hearing me as we go through. I can't see the chat in presentation mode, so definitely feel free to just interrupt if I'm going a little bit off the slides or if there are any technical issues. But before we get started, we did want to remind everyone to please mute yourselves. You're welcome to come off mute for questions, particularly at the end, but let's just make sure we're muted for this small presentation part of today. And also I wanted to remind you all that you are being recorded. This webinar is being recorded so that we can share it with anyone who is interested in this Behavioral Health Equity Challenge but is unable to make it today. So please just note that you don't have to ask questions verbally. If you don't want to be recorded, you are welcome to ask them privately in the chat to my colleague Tina Velocity or myself, Lauren Fulton, and that way we can get back to you without your voice being recorded if that is a concern for you. So we will go ahead and get started here. We are going to start with a very short introduction to OnePierce and move on to an overview of this grant program, the decision-making process for the grants, and then have time for discussion and any questions that you may have at the end. We're targeting a slightly shorter time, so hopefully we will give you a little bit of time back at the end of the hour. But really want to make sure that we're here to answer any questions that you might have about this program. So by way of introduction, my name is Lauren Fulton. I am the VP of Impact Investing with Elevate Health and OnePierce Community Resiliency Funds. I'm joined by my colleague Tina Velocity, Senior Program Officer at OnePierce, and she will be talking a little bit more about the grant program and decision-making process towards the middle of this presentation. To begin with, we wanted to just contextualize OnePierce Community Resiliency Funds and the work that we do. So OnePierce is the third kind of business line of Elevate Health. You may have heard of Elevate Health in the community. We hope you have. It is the accountable community of health for Pierce County, but really acts as a kind of neutral convener and an organization that coordinates care between clinical and community providers. So it does this work in 3 different ways. First of all, and the one that many providers locally in Pierce County are most familiar with, will be the Care Continuum Network. So this is its care coordination arm, which really works with different programs like health homes and the community health action teams to coordinate health with healthcare and care for social determinants of health within the community. The second arm is its data platform. This is all about breaking down silos of data within our community and helping organizations to get the information that they need. This is very much something that Elevate Health has been working towards and is still under development. As you're all aware, it has many challenges attached to it. And we're working with lots of different community partners to make sure that there is a community-owned kind of response to data locally. And OnePierce Community Resiliency Fund is the third arm of Elevate Health. It is its impact investing arm, or the investment arm of Elevate Health. So here at OnePierce, we offer 3 different types of funding: grants, community loans, and health innovation funds. Well, sounds like we've just had someone join us. If you have a question, feel free to ask. Otherwise, if you could mute yourself, there'll also be time for questions at the end. So OnePierce Community Resiliency Fund shares the mission and vision of Elevate Health. So our mission is to build and drive community coalitions that transform health systems and advance whole person health for all. And our vision is that every person in the communities we serve lives a full, healthy, and vibrant life. So impact investing through OnePierce is just one way that we help to achieve this mission and vision. The strategic pillars of OnePierce include these 3 different social determinants of health. OnePierce can invest across all social determinants of health, but as I'm sure you all know, that's a very broad category of different investments. And so we have selected 3 different priorities for last year and this year to help ourselves focus on particular goals. So within housing stability, as that strategic pillar, we aim for all people in Pierce County to have safe, stable, and affordable housing. Within workforce development, we want to ensure that Pierce County has a robust community of skilled and culturally competent health professionals who reflect the communities they serve. And within behavioral health, which is the strategic pillar that this particular grant opportunity is really focused on, we want to make sure that all people in Pierce County have equitable access to services supporting a healthy lifestyle. So behavioral health as this pillar is the kind of impetus for this behavioral health equity challenge, which you're here to learn more about today. But there are other opportunities for funding if your organization is interested in housing stability or workforce development. Do reach out to us and let us know, because we have other ways that we can support that work. We have 3 different programs of funding or kind of products that we like to discuss. One is around grants, and that is, again, I think what you all are here to learn more about today. So we have non-repayable funding within our grants program. In 2021, we had $200,000 budgeted for behavioral health projects. And again, that will all be going towards this behavioral health equity challenge. Next year, we'll have probably a different amount budgeted, and it may well be in a different area. But we aim to always have these pretty responsive grants available to the community at least once a year. However, OnePierce also has a fairly strong community lending program. So community loans are repayable plus 0 or low interest. This is very much focused on generating impact, and so we can also offer loans that have more favorable terms for demonstrating those social impacts. And then we have a 3rd program area. Just a reminder again to please mute yourselves if you've just joined us. We have a 3rd program area around health innovation funds, which is really catalyst funding for piloting new innovations in healthcare. And this is closing the loop with our Elevate Health partners and community, where we can be working to very, very closely to co-design and co-develop solutions for healthcare, which really transform the healthcare system. So this is the type of funding that we offer. And just as a reminder again, so this behavioral health equity challenge is really focused on our behavioral health strategic pillar. And it is a grant opportunity. So this is for non-repayable funding. However, do reach out if you're interested in any of the other opportunities that you see around either the different program areas or different types of funding that we also have available. And with that, I'm going to turn it over to Tina to talk a little bit more about this behavioral health equity challenge.
Hi, everybody. I'm turning my camera on in case you want to see my face. So nice to meet you all. Thanks for being here. I do want to pause just for a minute to see if anyone had any questions for Lauren about the kind of overview of OnePierce. You can either raise your hand or come off mute or turn on your camera. Okay, I'm going to assume that that means no. Feel free to shoot questions in the chat if you would like. No questions yet, I think. Yeah, okay. So I want to talk a little bit to you about the Behavioral Health Equity Challenge, which is the grant program that you're all here to learn about. We talked a little bit about OnePierce's mission and the different areas of focus for us. This year, what we're interested in is your ideas of how do we increase access and integration of behavioral health. We have $200,000 of funding available. Our plan is to not have any minimum, so some of the projects can be small or community-based, but to have a $50,000 maximum so that we can spread across a few projects. As you know, the notice of funding availability was released last week, and then 2 weeks from today is the due date on September 22nd. In terms of the decision-making, we are going to have a grant selection committee, which we'll talk about in a few minutes, who makes that up and how they'll do their decision-making. We also, as Lauren had mentioned, our priorities this year for this round of grants is increasing the capacity of behavioral health programs, increasing access, and then behavioral health and physical health integration. That said, those are the priorities. However, we are definitely open to any projects that help to improve health outcomes for folks, advance health equity in the realm of behavioral health. And so one thing that I think might be helpful is just to make sure that we have a common definition of behavioral health. So the way we are thinking of that is behavioral health describes the connection between behaviors and the health and well-being of the body, mind, and spirit. So it's pretty broad. I think often we talk about behavioral health as mental health, while I think, and that is a huge important focus of ours, it's not exclusive to that. So let me pause there for a minute and see if anybody has any questions on the overview.
Oh, sure I do.
Of course I could count on you, Greg.
I knew you could. So my assumption is that behavioral health also includes substance use disorder.
Correct.
Okay.
Yep.
Just wanted to make sure. Thank you.
Yes. All right, Lauren, next slide. So I thought it would also be helpful to share the areas that we are considering when we're reviewing and scoring the applications or proposals. So there are these 5 areas that we will be thinking about, and each of these areas also has a question related to it on the application form, so that you will be able to give us some information to be able to consider that. So first, the ability of the project to expand access to behavioral health services. And so in terms of expanded access, that can mean a variety of things. It could mean helping to reach new people or a different population of people than you have been reaching with your programs before, working to serve the same people, but in a deeper way than maybe you had been before. You can also think about it as building capacity to be able to be more efficient in how you serve folks, or to really drive toward improved outcomes. So I think we think about expanding access in a variety of ways. Alignment with whole person health is really getting back to that idea of how are we addressing the entire person in services. So even though your particular program that you're proposing may be focused on, for Gregory's example, substance use disorder, how are you also integrating other parts of whole person health into the services, or the way you're connecting your clients with helping to advance their goals around their health? The focus on health equity is really about how are we advancing the idea that everyone in Pierce County can access health services. So really thinking about who traditionally has not been able to access those services, and how do we help to support the most vulnerable populations in our county. Diversity and inclusion. Here we are not only talking about who you serve, but who is doing the serving. So how does your organization reflect diversity in its leadership? How connected is it to the to communities of color? And how are you really connecting culturally with the communities that are the most vulnerable in our county? And lastly, value for investment. And we say value rather than like thinking about the number of people served. We really want to think about, are we serving a few folks very deeply? Are we serving many folks in a smaller way? So we're going to really consider a variety of approaches to looking at the value of the project. Why don't I pause there for a minute and see if anyone has questions about this scoring? Okay. Let's move on then. Lauren, you can do the next slide. So I want to talk a little bit about process and then the selection committee itself. And I want to just say thank you for Adriana Wilson for being here today. She's listening in. She's going to be part of the selection committee. Our plan or approach here is that we will receive your proposals on the 22nd of September or before if you're a super Johnny on the spot. And then the staff, Lauren and I, will go ahead and score them using the criteria that we laid out in the last slide. And then at the end of the month, this group of people, Ann Mumford, who is a community representative, she's a longtime advocate for women's health and HIV and AIDS educator, and also very engaged with her faith community. She serves on our community advisory committee, and so she's going to participate. Adriana is going to participate. She is a community activist. She's a consultant who is focused in anti-racism work. She also serves as the co-coordinator of the Food and Justice Program at the Puyallup Watershed Initiative. So we're excited to have her. Kim Bjorn, who works with Elevate Health, is a behavioral health specialist. She's been a social worker for 20 years, has her own private practice, and then has also worked in hospital settings. John Levi, who some of you may already know, is our community engagement and outreach person. He does a lot of work in diversity, equity, and inclusion, as well as community engagement. So he will serve as the representative for Elevate Health. He's done a lot of work with the Urban League and with the faith community. We're just really lucky to have him on our team. And then Lauren, who you've already met. So when we gather and have those folks take a look at the proposals, they'll get scored proposals scored by the staff. And then they will go ahead and rank those proposals based on their own sense of importance, how they serve the community. So we are not necessarily only making awards to the top scoring projects. What we want to do is look at all of these investments as a portfolio and ensure that there's diversity in terms of the kinds of projects, the size of organizations, the populations that are served, and really look at it as how are we holistically making investments in our community. And then when we meet as the selection committee, they will go ahead and make the decision about which projects to fund. The staff will go ahead and figure out the amounts for funding, and then we'll make announcements in early October. I think that might be the last slide, Lauren, is that right? Yeah, questions. So do people have questions about the process or the decision-making or what kinds of projects might be appropriate? I'll just let's open it up and feel free to come on camera, off mute, or shoot some questions in the chat. Hi, Tracy.
Hi, I have a question about how you're defining behavioral health. So I'm the executive director at Catherine Place, and we do not do counseling, but we do emotional and spiritual support, which obviously supports holistic health. And so I was interested in this opportunity because I wasn't sure how you were judging the eligibility for the behavioral health component.
I think what you're describing absolutely falls into behavioral health. And I was going to type the definition that we're using, which I spoke to a little bit earlier, but really it's about looking at the whole person, and that includes all the behaviors that contribute to their health and well-being, mind, spirit, and body. So definitely, I think what you're talking about in terms of emotional well-being and supports fits into the definition of behavioral health.
And I'm also wondering if this is only applicable to emerging programs or if there's a possibility of support for existing programs.
We are definitely open to supporting existing programs. I will say that the goal of this is to increase access. So I think what we would be looking for is this grant going to help you do something differently or build capacity within your existing program to help it expand or serve either people in a deeper way or serve more people or a different population?
Great, thank you.
Think that there's a question from Lauren Angelo in the chat about capital purchases. Yes, I think that is certainly possible. I guess I would want to understand a little bit more about what behavioral health safe spaces means. Do you want to maybe give a little bit more voice to that and help me understand exactly what that means and what kind of capital purchase you'd be talking about?
Yeah, I'd love to. So in the process of building a new library in East Pierce County, we are creating a shared community partnership organization room where services can be offered in that one room and only used by service providers. Part of that is trusting their expertise in knowing what kind of furnishings to put in that room and how to make it a safe space. So that's the idea.
Yeah. I think that seems good. I think we're talking also about this idea of integration of behavioral health and physical health, but also I think integration of behavioral health into spaces that make it more accessible and reduce stigma for folks. So I certainly think that sounds like an interesting project. We'd love to learn more about it.
Great, thank you.
Any other questions?
And I'm going to go ahead and put it back to the overview slide in case that jogs anyone's questions or thoughts.
Thanks, Lauren. Well, if there are no more questions, or at least no more questions in this space, we definitely can close. Happy to entertain any other questions you have afterwards. You can email the info@onepierce.org, and both Lauren and I get that, and we can respond to you. We will also post this recording on the website, on the website for the Behavioral Health Equity Challenge, and I think we can probably just go ahead and send out these slides to everyone who is in attendance. If there are other folks who you think would be interested in this, we very much are asking for people to share this opportunity with their networks. We're really excited about being able to work with some non-traditional partners like the library. That sounds super interesting, and just making sure that we're reaching out to communities who may not typically be on the distribution list for these kinds of opportunities. So thanks so much, everybody. Okay, I think it's just the three of us now. Can Francie close it? I'll send a note.